everyone, my name is Justine from Baguio Central University, and for today's video, I will be doing eye assessment return demonstration. Good morning, sir.
Good morning to sir.
My name is Justine from Baguio Central University, and I will be your student nurse for today. Sir, I will be inspecting you on the eye, and I am going to inspect and palpate some part of your faces, especially in the eye area.
Okay.
Sir, the purpose of this assessment is to help detect eye problem at the earliest stage and to eventually provide tips in taking care of your eyes.
Yes.
Okay, sir. Before I will assess your eye, I will now perform hand hygiene to prevent the microorganisms in spreading. Sir, rest assured that the information or the data that I will be gathering in this assessment is highly confidential between me and the attending physician that I will be referring you to. Okay, sir, I will now close the curtain to provide you privacy. After securing the client's privacy, I will now proceed on the first step, in which I will be checking the sensory function of the cranial nerve number 2 or the optic nerve. Sir, in assessing your cranial nerve number 2 or the optic nerve, I will be showing you a Snellen chart, in which I will be putting the chart 20 feet away from you, and I want you to read the letters from top to the bottom.
Yes. Okay, sir.
Is that okay with you?
Yes, sir.
Okay. Okay, sir, start reading the letters.
E. F P. T O Z. L P E D. P E C F D. E D F C Z P. F E L O P Z D. D E F P O T E C. L E F O D P C D.
Okay, sir, thank you for your cooperation. Sir, I will assess now your right eye, and I want you to cover your left eye for me and read the letters on the line number 6.
E D F C Z P.
How about the line number 7?
F E L O P Z D.
How about the line number 8?
D E F P O T E C.
Okay, sir? Okay, sir, can you cover your right eye naman and use your left in identifying the letters on the line number 6 naman po?
E D F C Z P.
How about line number 8, sir?
D E F P O T E C.
Okay, sir, uncover your eye. After assessing for the sensory function of cranial nerve number 2 of the patient is able to read letters in the line of 20/20 vision for his both eyes. I will now proceed to step number 2, which is the checking for the peripheral vision of the patient. Okay, sir, I will now check for your peripheral vision, and to do that, I will be using the confrontation visual field. Imagine that we are being divided by 4 quadrants. And in assessing your both eyes, I want you to focus on my eyes, and in identifying the fingers that being raised, don't try to move your head. Just focus on my face.
Okay, sir.
Okay, I will now check for the vision of your left eye. And please do cover your right eye, sir.
Okay.
Okay, sir?
Okay, sir. 1, 2, 3, 4.
Okay, thank you. So next, let's check for the vision of your right eye. And to do that, I want you to cover your left eye, sir.
Okay.
Okay.
2, 1, 3, 4.
Okay, sir, thank you. After checking for the peripheral vision of the patient, I will now inspect for the eyebrow and the eyelashes for color and for the distribution. Okay, sir, I will inspect now your eyebrow and your eyelashes. After inspecting the eyebrow and the eyelashes of the patient, I noticed that the terminal hairs are evenly and equally distributed, and I haven't seen any dryness of the skin. And I also noticed that the color of the hair is black and there is no discoloration. I will now inspect for the upper and lower lids of the patient. I will check for its color, for inflammation or edema, and the adequacy in which the eyelid closes. Okay, sir, I will inspect for your upper and lower eyelid. After inspecting for the upper and the lower eyelid of the patient, I noticed that the color of it is brown and it is normal. I haven't seen any redness, bluish, or yellow discoloration of the skin. I also noticed that there is no presence of inflammation or any sign of edema, and the adequacy in which the eyelid closes is in normal naman. After checking or inspecting for the upper and lower lid of the patient, I will now inspect for the lacrimal apparatus. After inspecting or checking for the lacrimal apparatus of the patient, I haven't noticed any mass formation or bulging of it. Okay, I will now palpate for the lacrimal apparatus of the patient. Okay, sir, in palpating for your lacrimal apparatus, I will be touching the surrounding of your eye. Is that okay with you, sir?
Okay, sir.
Okay. After palpating for the lacrimal apparatus of the patient, I've noticed that there is no excessive tearing. After palpating for the lacrimal apparatus of the patient, I will now inspect for the sclera. After inspecting for the sclera of the patient, I haven't noticed any redness, yellowish, or bluish of it. It is shiny white and that is normal. Okay, I will now proceed on the next procedure. After inspecting for the sclera of the patient, I will now inspect for the bulbar and palpebral conjunctiva. Okay, sir, I will now inspect for your palpebral conjunctiva. To do that, sir, I will pull down your lower lids and you will look upwards. Okay? Okay, sir. Okay, sir, thank you. And I will also check for your bulbar conjunctiva and I will pull upward your upper eyelids and look and try to look downward, sir. Okay? After inspecting for the palpebral and the bulbar conjunctiva of the patient, I've noticed that the color of it is pinkish and that is normal. I haven't seen any redness or bluish or yellowish of it. And I haven't noticed any inflammation or any sign of irritation. After inspecting for the bulbar and the palpebral conjunctiva of the patient, I will now inspect for the cornea and the iris of it. After inspecting for the cornea and the iris of the patient, I noticed that the color is black and shiny. I haven't noticed any mass formation on it, and that is normal. Okay, after inspecting for the cornea and the iris of the patient, I will now check for the corneal reflex or the cranial nerve number 5 of the patient. Okay, sir, I will now inspect for your corneal reflex. Open your eyes, sir. The other side, sir. Okay, after inspecting for the corneal reflex of the patient, I noticed that the patient blinks and tearing occurs.